All right, Hafaday, and welcome to the show. Now, in this series, we've been talking mostly to Dr. Kelly from AMC, but now she recommended we get someone else in here to talk to us as well, and we have Dr. Tren, also from AMC. Now, Dr. Tren, first of all, welcome to the show. Thanks for joining us.
Thank you for inviting me.
Now, we wanted to go over some things that Dr. Kelly has mentioned to us, and the goal of what you and Dr. Kelly and everyone over there at your division of AMC is for people to maximize their Medicare benefits, make sure that they're getting the wellness that they deserve, increasing their quality of life, and just basically helping them navigate the huge task that is Medicare. So the wellness check is a big part of that. Let's go ahead and start there and talk about the wellness checks.
Okay. First of all, I just want to say that the Medicare program, the Medicare is an insurance. And I just want the people on the island to know that it's a great insurance program, but unfortunately, a lot of people don't really understand the benefits and not take the full advantage of Medicare. And Medicare has many benefits, and one of them is the annual wellness visit. The whole concept of annual wellness visit is that Medicare is paying once a year for a physician to sit down with the patients and to talk with the patient about preventive care and to look and also to discuss with the patient the various chronic conditions that the patient has, and then formulate a plan, an annual plan to ensure that the patient stay healthy and to keep the patient out of the hospital and from coming to the ER. That's the whole idea. So it is one of those benefits that people are not taking advantage of, and we are here. We want to the people want to know about it so that they can come to their doctor for this type of visit, and Medicare will pay 100%. There's no co-insurance, there's no 20%. It's one of those appointments that Medicare recognized the benefits of it, and therefore was willing to pay 100% of it.
Okay, yeah, and that's a good point you bring up, is that Medicare, they basically want people to remain healthier while they're on Medicare, so they don't need those huge hospital visits. So it's in everyone's interest to keep them healthy and have these checkups to make sure that you're up to date on the policy, your treatment, medication, and whatnot. And again, one thing that Dr. Kelly has stressed is that this is different from someone's primary physician. So they can maintain their primary, but also have you and the other team over there to help navigate the Medicare aspect.
Yes. Preferably, we wouldn't want the primary care physician to do this themselves with their patient. But if for some reason that this is not happening, it's okay for a patient to find someone who's willing to sit down with him or her to do this. And people understand that the annual wellness visit is not focusing on medical issue only. The whole idea of annual wellness visit is to focus not only at the medical conditions, but also the social support network, and also the mental health and other issues that patient may have beside medical.
Right.
So we talk about, so during that visit, we also try to understand the social situation that the patient is in, because it plays a huge component in the overall well-being of a patient. We also discuss advanced care planning, which has to do with what you want to do in case something wrong happened. Do you want to be kept alive on machines, or you want to have resuscitation? So we talk about many different issues besides just the patient medical problems.
And a bunch of things that you mentioned there, I think that are very important. One of them being the cost. I think a lot of people, they hear health insurance, medical insurance, they think, okay, this is going to be expensive. But Medicare, it tries to kind of keep those costs down and requiring this visit. So let's talk about the cost to the people and how they go about paying for Medicare.
Okay, so Medicare is like many private insurance. There are types of appointment where Medicare willing to pay 100%. Annual one visit is one. There are also some procedures that Medicare is willing to pay for 100%. These are preventive care procedures, colonoscopy, mammogram, flu vaccine, pneumonia vaccine. So there's a list of benefits that Medicare willing to pay completely. And this is what the annual wellness visit is all about. During this visit, your doctor should sit down with you and say, these are the preventive care benefits that Medicare have to offer. And these benefits, Medicare will pay for 100%. And then they can also discuss other benefits where, Medicare will as only pay 80%. But these are the things, it's all part of this annual wellness visit. That's why it's so important. It lay out the entire plan for the year for the care of the patients.
And it's important for that preventative medicine because, just like servicing your car, it's much cheaper to service it regularly than to fix it if the engine completely breaks down. So limiting those huge costs by getting the little preventative checks along the way, the wellness check.
You are absolutely correct. I find it quite amazing that people would take care of their cars better than they take care of themselves. One of that is one of the flaws of our healthcare system. Traditionally, people only come to the doctor when they're sick, right? That's how you do. That's what happened. If I feel great, I don't go to the hospital. I don't see my doctor. And that is one of the most difficult things I have to do with patients is sitting down and explain to them, look, I don't want to see you when you're sick. My goal is I want to see you when you are well and keep you well. That's the whole concept of what we're doing right now is that the whole idea is to keep you healthy. So that's why, we need to see you on a regular basis. And to most patients, that's a totally 180-degree turn from the way how they see medicine. Yeah. And but once they understand it and they go, oh, okay, now I see what you're trying to do, and they are very excited about it and very supportive of the program.
And we all know that to stay healthy, you have to have a good diet, have to exercise regularly. And when you're dealing with Medicare patients, most of them are 65 or older. So how do you kind of adjust that for someone that is a little bit older just to stay healthy instead of having to go see you when the check engine light comes on?
Mm-hmm. You are absolutely correct that diet and exercise plays a tremendous role in keeping people healthy, more than medicine, I believe. Now, the way I deal with this is that when people hear the term exercise, they think about you have to go out there running, hard and for 30 minutes. The way I do it is any kind of activity is important. And our brain is funny in the sense that it likes positive reward. So what I tell patients is that start out something small so that you can achieve it. Because when you achieve it, you feel good about it, and it is a stepping stone to a harder program. For example, in my patient, I would say who hasn't done any activity for a while, I said, start out with walking 5 minutes, simple walking, just 5 minutes a day. Okay, do it for a week, and you don't have to do 30 minutes. Do 5 minutes. That's all I ask. So when you do 5 minutes and just simple walking around the house, just get off the couch, get off the and get out from the TV. Just walk around the house just for 5 minutes. That's all I ask them to do. So that's how I do it. You start with 5 minutes, and they go, "Oh, that's easy, doctor. It's only 5 minutes." Yes, do it for a week or two, and as you feel better, let's go up to 10 minutes. So that's how I do it. And like I said, when you do that, and people, it's achievable. And when people achieve these tasks, they feel good about themselves. The brain feel good because, hey, I've done something here. So, and this is how you build on that. Same thing with diet. I don't believe in, a lot of people say, oh, you have to stop eating this, stop eating that, this is bad for you. I don't believe in that. I believe in moderations. It's difficult, for example, on this island, if you go to a patient, tell them, you need to stop eating rice. You might as well.
Just never mind, cancel, doc. Yeah, pull the plug.
Guys might as well not saying anything else because it's an impossibility. But again, it's not necessary. It's moderations. It's okay to eat rice. Even if you are diabetic, it's okay to eat rice, but cut down on the amount. And you don't have to cut down big either, cut down 10%. Again, everything, do it in the smallest step and allow the body to adjust. And I think if you focus on that, and you will realize, I've done this for 30 years, all these things are very achievable. Just small steps, small increment, and work on that.
And I think that's the main thing that you wanted to stress is that you don't have to start by running a marathon if you're 70 years old. Just walk around the house, maybe do a little gardening, if you have some potted plants, just to keep you moving and getting outside. And the diet, those little bit of changes, these smaller goals will eventually pay huge dividends. So I think that's the best way to do it. And you obviously sit down with your patients on a regular basis to go over these wellness checks. What are some of the biggest concerns that patients have and questions they have when they come to you?
I think that for the concern that patients have is very local. What I mean is that in California, it's different. Northern California is different. Southern California is different. Central Valley kind of different. And so the same thing is in Guam. Different populations have different concerns. And one of the biggest concerns on Guam, I think that people realize, is the incidence of diabetes and the incidence of obesity and how it's impacted the quality of their lives. And one of the difficulty in dealing with these issues is that trying to get patients to get onto a program so that they can have a meaningful weight loss. And to a lot of, as you know, in Guam, obesity is a huge problem. And how we and people have been trying to get get their weight under control, and they have been unsuccessful. And one of the reasons when I talk to patients about this is that stop listening to the media, the newspaper, on television, and all the movie stars telling you that, this exercise program will have you lose 10 pounds in a month. Eat this ketogenic diet and you can lose, 15 pounds in a month. And I tell them, don't do that. You do that, you're setting yourself for failure. Even if you're successful, you're going to last maybe 1 or 2 months, and then you'll fall right back to your, to your previous weight and worse. So when I talk to people, focus on 1 or 2 pounds a month. And they look at me whenever I tell them, I said, what? That's all you ask? 1 to 2 pounds? I said, yes, think about it. Even if you lose 1 pound a month, after a year, that's 12 pounds. After 2 years, it's 24 pounds. I play the long game. And to me, when you do that, you allow the body to succeed and to adjust and to succeed and to keep that weight off. So to answer your question, that's on the big concern of a population, for this population is their weight, is their obesity, and the impact that obesity has on their health, and the difficulty of trying to lose weight based on all what they see all around them, on these TV commercials and on these weight loss programs telling you can lose 30 pounds in 2 months, that kind of stuff. And people try and they fail, and then now they're coming in with, it's impossible for me to change who I am, and therefore there's no point of trying. And that's when I spend most of my time, is trying to convince people, no, it's not impossible. To set small goals, achievable goals, and play the long game. Don't try to do a short-term game.
Right, and that's the key is, looking at the bigger picture, not just, hey, 2 weeks from now, I need to lose 15 pounds. That's never successful. So these wellness checks, they're important. And people, if you're on Medicare, you need to set one up. You can call American Medical Center there in Tamuning at 648-9110. Dr. Tran, we know you're a busy man, so thank you very much for your time. Anything else you want to add before we let you go?
No, I just want to say, Mr. Will, thank you so much for giving this opportunity to talk with you. And I just hope this message will reach the population of Guam. I still want them to know that Medicare is probably the greatest insurance program. Okay, there's a lot of benefits, but there's also a lot of myth and misinformation about Medicare out there. Don't believe them. Go find it. Talk to your primary care physician. Ask them for assistance and to help you with your Medicare. There isn't anything that in term of Medicare medical issues that Medicare has not addressed. There isn't any kind of procedures, medical procedure that you need that Medicare would not pay for. I hear this all the time. I would have patients telling me, "Oh, Medicare would not pay for my knee replacement." I said, "Who told you that?" So please, Medicare to me is the greatest insurance program, and so take advantage of it and use it to keep yourself healthy. And if you have any questions, if your doctor can help you, you can always come to us. We're very happy to assist you, and then you can go back to your physician and continue the care of that physician.
All right, fantastic, Doctor. There's a lot to discuss here, so I'm sure in future segments we will cover as much as we can. Thank you again.
Again, thank you for your time. Take care. Bye-bye.